1 in 4 peoples over 60 is suffering silently from joint pain caused by something they've never heard of. Right now, crystals are forming in your joints while you sleep. You've probably been told that joint pain is just part of aging, that you'll simply have to live with it. But here's what your doctor might not have told you. This pain isn't inevitable. In the next 20 minutes, I'm going to show you exactly why your joints hurt and what you can do about it starting today. How many of you wake up and feel that stiffness in your knees or fingers before you even get out of bed? You know that feeling, when you swing your legs over the side of the mattress and there's that moment of hesitation because you're not sure if it's going to hurt. Some of you have learned to move more slowly in the morning. You might have even changed which hand you use to grip the coffee mug. You've adapted. But you shouldn't have to keep adapting. That's what we're going to change today. I'm Dr. Livia Carter. I've been helping patients like you understand their bodies and take control of their health for the last 20 years. I'm grateful you're here. Please tell me in the comments, where are you watching from? How old are you? And what health problem are you facing today? I read your comments, and I want to understand what brought you here. Over the next few minutes, I'm going to explain what uric acid actually is, not in complicated medical terms, but in a way that makes real sense. Then, I'm going to walk you through the practical things you can do in your own home, with foods you probably already have in your kitchen, to help your body get rid of excess uric acid naturally. And I'm going to help you understand why your joints might feel better sooner than you think. By the end of this video, you're going to know exactly what's causing that joint pain. You'll have a clear picture of how your body's waste system works, and most importantly, you'll have real, actionable steps you can start today. No fancy supplements, no complicated routines, just straightforward approaches that fit into your daily life and actually work. Let me start with something simple. Your body is constantly breaking down and rebuilding itself. This is normal and healthy, but some of that breakdown process produces something called uric acid. Think of uric acid like the ash that's left over after a fire. Just like a fireplace needs to be cleaned out regularly, your body needs to get rid of this uric acid regularly. For most people, the kidneys do this job beautifully. They filter the uric acid out and send it to your urine. Problem solved. But for some of us, especially as we get older, something changes. Either your kidneys aren't filtering as well as they used to, and this is completely normal with aging, or your body is producing more uric acid than your kidneys can handle. Or sometimes both things are happening at once. When too much uric acid stays in your bloodstream instead of leaving your body, it starts to crystallize. These crystals are like tiny shards of glass, and they settle in your joints. Here's the beautiful part. This process can be reversed. Your body is incredibly smart. If you give it the right conditions, it can dissolve these crystals, clear out the uric acid, and your joints can feel better. I've seen this happen in my patients again and again, sometimes within just a few weeks. Now, let's talk about what increases uric acid in the first place, because understanding this is half the battle. There are certain foods that your body breaks down into more uric acid than others. Organ meats like liver and kidney, certain seafood like anchovies and sardines, and red meat. These are high in something called purines, and purines convert to uric acid. Alcohol, especially beer, actually tells your kidneys to hold on to uric acid instead of releasing it. And sugar, particularly in sugary drinks and high fructose corn syrup, increases uric acid production significantly. But here's what I want to emphasize. Knowing this doesn't mean you're eating wrong or that you've done something bad to yourself. Many of you grew up eating these foods without any problems. Your body's filtering system just needs support now, and that's what we're going to talk about. I want to pause here and ask you something. Have you noticed if your joint pain gets worse after certain meals? Maybe after a steak dinner or a night out where you had a few drinks. That's not a coincidence. That's your body giving you a signal. It's not a sign of failure. It's actually helpful information that you're getting right now. The most powerful thing you can do to lower uric acid is actually very simple. Drink more water. I know you've heard this before, but let me explain why it's so important. Water is like a river. Uric acid crystals dissolve in water. When you have plenty of water flowing through your system, your kidneys can work more efficiently. They can filter out more uric acid and send it away through your urine. Think of it this way. If you had a sink and you only turned on the faucet once a day, the drain would get clogged. But if that sink had water running through it regularly, it stays clean. Most of my patients don't drink enough water. Not because they don't want to, they just forget. They sip coffee or tea in the morning, maybe have water with lunch, and that's about it. I want to suggest something that actually works. Drink a large glass of water when you wake up. Drink another glass mid-morning. Have water with your lunch. Another glass in the afternoon. And then ease up in the evening so you're not waking up in the middle of the night. That's roughly 6 to 8 glasses spread throughout the day, and it's genuinely a game changer. How much water would you say you're drinking right now? Be honest, most people are shocked when they realize how little it actually is. Now, there are certain foods that actually help your body process uric acid better. Cherries, tart cherries especially, contain something that helps your kidneys filter uric acid more effectively. Berries are wonderful. Citrus fruits like oranges and lemons actually help your body's pH balance, which makes it easier to dissolve uric acid crystals. There's something almost magical about lemon water. The citric acid helps alkalize your body slightly, and this can reduce uric acid levels. I have patients who just squeeze fresh lemon into their water bottles throughout the day. Vegetables, particularly the leafy green ones, are incredibly helpful. Kale, spinach, Swiss chard, these are low in purines. They're high in vitamins that support your kidneys, and they contain compounds that actually help reduce uric acid. Dairy products are interesting too. Milk and yogurt actually have something in them that helps your kidneys excrete uric acid more efficiently. If you can tolerate dairy, it's genuinely helpful for this issue. The beautiful thing is that you're not giving anything up here. You're not going on some restrictive diet. You're adding water, adding cherries to your breakfast, making a green salad part of your lunch, having some yogurt as a snack. These aren't punishment foods. These are foods that taste good and make your body feel better. That's the opposite of deprivation. Let me talk about weight for a moment because this matters. If you're carrying extra weight, your body produces more uric acid. This isn't about vanity or judgment, it's pure biology. Fat tissue actually produces uric acid as a byproduct of its metabolism. Additionally, when you're overweight, your kidneys sometimes struggle to work as efficiently. So even modest weight loss, and I mean modest, like losing 10 or 15 pounds if that applies to you, can make a significant difference in uric acid levels. But you don't need to do anything extreme. Gentle, gradual changes are what stick. Movement matters too. I'm not talking about training for a marathon or doing intense workouts if that's not your style. I'm talking about gentle, consistent movement, a 20-minute walk after dinner, swimming or water aerobics, which are wonderful for joints because the water supports your body, yoga or tai chi, which are genuinely therapeutic for joints and also help your body's detoxification systems work better. These kinds of movement help your kidneys function better, and they also help you maintain a healthy weight without being punishing. Here's something I want you to notice. Everything I'm telling you about, drinking more water, eating more vegetables, moving your body gently, maybe shedding a few pounds, these things don't just help uric acid. They help your heart. They help your blood pressure. They help your digestion. They help your sleep. This isn't about one problem. This is about creating an environment in your whole body where things work better. Now, let's talk about something that matters more than most people realize, your stress level. When you're stressed, your body releases cortisol, and cortisol actually increases uric acid production and decreases how efficiently your kidneys work. Some of my patients notice their joint pain gets worse during stressful periods of their lives. It's not their imagination. The stress is biochemically affecting their uric acid levels. What brings stress down? Sleep. Real, quality sleep. When you sleep, your body does its repair work. Your kidneys clean themselves more efficiently. Your inflammation goes down. I recommend getting to bed at a consistent time each night, keeping your bedroom cool and dark, and maybe putting your phone in another room so it's not tempting you. I know this is easier said than done, but even improving your sleep by 30 minutes can make a real difference. Also, things like meditation, even 5 minutes a day, or simply sitting quietly listening to music or being outside in nature. These aren't luxuries. These are maintenance for your system, just like changing the oil in your car. What's one thing from what I've mentioned so far that you think you could actually do this week? Not everything, just one. Write it in the comments. I want to know. I want to address something that comes up with many of my patients. Medication. If your uric acid is very high, usually above 9 or 10 milligrams per deciliter, or if you've already had gout attacks, your doctor might recommend medication to lower uric acid. Allopurinol and febuxostat are common options. I'm not here to tell you whether you should or shouldn't take medication. That's between you and your doctor. What I am telling you is that the changes we're talking about, water, food, movement, sleep, stress reduction, these work alongside medication. They don't replace it, but they enhance it. They make medication more effective, and sometimes, with your doctor's guidance, they can eventually mean you need less medication or different medication. Some of you might have had a gout attack, that sudden, intense pain that comes out of nowhere, usually in the big toe. Gout is what happens when uric acid crystals form so suddenly that your immune system reacts strongly. It's painful, but it's also a signal. It's your body saying, we need to address this. After a gout attack, many people finally take action, and that action, the water, the food changes, the movement, that action works. If you've had gout, you know that fear, you know you don't want it again. The good news is that by doing the things we're talking about, you can prevent future attacks. You can get to a place where your uric acid stays low enough that gout simply isn't a risk anymore. I have patients who had gout regularly, sometimes twice a month, who haven't had an attack in years because they implemented these changes. Let me give you some specific numbers so you have a target to work toward. Your doctor can check your uric acid level with a simple blood test. For most adults, a healthy range is somewhere between 3.5 and 7.2 mg/dl. If your number is higher than that, you want to bring it down. The good news is that most people can move their number down 1 to 3 points just through lifestyle changes, the water, the food, the movement, within 3 to 6 months. That's often enough to eliminate joint pain and prevent attacks. There are some other things that can help, and I want to mention them because I've seen them make a real difference. Vitamin C is interesting. It actually helps your kidneys excrete uric acid. A moderate amount from food, oranges, kiwis, peppers, broccoli, is really helpful. Coffee, interestingly, has compounds that help lower uric acid. If you drink coffee and enjoy it, this is good news. Moderate tea consumption has similar benefits. On the flip side, I want to be honest about things that tend to make it worse. High fructose corn syrup is one of the worst culprits. It's in many processed foods and sugary drinks. If you can start reading labels and moving toward foods without it, that's huge. Excess alcohol beyond 1 drink a day for women and 2 for men interferes with kidney function. And while we mentioned high purine foods, you don't need to eliminate them entirely. Just moderate them. Having red meat a couple times a week instead of several times a week can make a difference. I want to come back to something I said at the beginning. You've probably adapted to this joint pain. You've changed your life around it. Maybe you don't do certain things anymore because of the pain. That's what brought you here today. But here's what I know. Your body doesn't want to be in pain. It's not designed for that. And with the right support, it can heal. One more thing I want to address because people ask me about this. Supplements. There are a lot of supplements marketed for joint pain and uric acid. Some have a little bit of research behind them. Others are just expensive. I'm going to give you my honest take. Before you spend money on expensive supplements, get the basics right. Get your water intake up. Get your food right. Get your sleep right. Move your body. These cost very little. Water is free, vegetables are cheap, walking doesn't cost anything. Do this for 2 months. Then, if you want to add something, talk to your doctor about it. But 9 times out of 10, you won't need to because you'll already feel dramatically better. What's the biggest barrier for you in making these changes? Is it remembering to drink water? Is it knowing what to cook? Is it finding time to move? Tell me in the comments. I want to understand what's actually hard for you so that I can help. Let me close this section with something that matters. You're not broken. Your body isn't failing. You have more control over this than you might think. I've had patients come to me with joint pain so severe they were considering surgery. Within a few months of doing the things we've talked about, they didn't need surgery. They could walk without pain. They could play with their grandchildren. They could garden. They could live the life they wanted. This isn't magic. It's just your body responding to being taken care of in the way it actually needs. Every single day that you drink enough water, that you eat nourishing food, that you move your body, that you sleep well, that you manage your stress, every single one of those days, your uric acid level is going down slightly. Crystals are dissolving. Your kidneys are working better. You're moving toward a life without joint pain. It's not all or nothing. It's not perfection. It's just consistent, gentle care. And that works. Here's what I'd love from you right now. In the comments below, answer one or both of these questions. First, what's going to be the first change you make this week? Is it the water? Is it adding cherries to your breakfast? Is it an evening walk? Tell me. And second, share your biggest success story about joint pain or health in general. I read every comment, and your story might inspire someone else to take action. Before I close, I want to say this. Everything I've shared with you today is for educational purposes and comes from my experience over many years of medical practice. But everyone is different. Everyone's body is unique. I encourage you to share what we've discussed with your own doctor, especially if you're on medication or if you have other health conditions. Your doctor knows your full picture, and that conversation matters. This is about you and your doctor working together to take care of you. In my next video, I'm going to talk about something that surprised me when I discovered it. There's a particular category of foods that most people think is healthy, but is actually making joint pain worse. I can't say more here because I want to really dive deep with you on that topic. Make sure you're subscribed so you don't miss it. Thank you for spending this time with me today. I know you're busy. I know you probably have aches and pains and you've been told they're just part of getting older. I want you to know that doesn't have to be your story. Your body is more resilient than you think. It wants to heal. It's waiting for the support it needs. I hope you'll give it that support this week. I'm rooting for you.